For the patient that has decided to have laparoscopic keyhole surgery for the treatment of the cancer of the prostate, the routine of this treatment would be that the day before the surgery or the night before surgery, patient would be fasted from midnight. They normally would present to the hospital at about 6:30 in the morning of the day of the surgery, depending on the time that their surgery has been scheduled for. The anaesthetist would see the patient early that morning. They would have the different lines put in that would need to be that are required for the surgery, and also they will be having the monitors and attached at the time. We also apply calf compressors for the patients, which is very important part of the treatment, because we want to prevent DVT, which is the deep vein thrombosis, and possible pulmonary emboli. And this is attached before the patient comes to theatre. And usually the protocol for this would be that we keep the calf compressors on throughout the case and also 24 hours after the procedure. And this certainly minimizes the possibility of a deep vein thrombosis and possible pulmonary emboli. At the time of the procedure, on the day of the procedure, I would discuss the treatment again with the patient, and also what they will expect after the surgery has been completed. Patients will have an indwelling catheter inserted in the bladder, and also they will have a drain on the side, which we will leave for a couple of days, and that would be removed prior to the patient goes home. The procedure itself, it would vary between 2 to 3 hours in length, and when they wake up, they will be waking up in the recovery. Then they will be looked after there by the nursing staff until they are fully awake, and then as a routine they will be sent to the ward. After the procedure and while the patient is in recovery, I will give the patient's partner a call and let them know how the procedure went, so that the partner is also comfortable and stops worrying about the loved one. I think it's very important that the partner is also looked after, because this is a journey not just for the patient but also for the partner. Later on that evening, I will go and visit the patient in the room and make sure that everything is going fine and they're comfortable, and also they can start having a cuppa that evening, and so they can refresh. The following day, the patient is able to have a shower on his own, and because they have minimal pain, they are able to do so without much help from the nursing staff. Also, the 24 hours after surgery, they will be able to go and walk around in the ward without too much difficulty. And we will then also progress their intake into a light diet. This is possible because the patients have had keyhole surgery with minimal disturbance, minimal pain, and hence they are able to progress so much quicker into the next stage of their recovery. The following day, which is day 2, the patients are fully mobile. They are taught how to look after the catheter. They are taught how to look after the leg bag, and by that stage we would remove the drain for them. On day 3, I visit the patients, and we have a ward round, and then we check their progress. Good morning.
Hello.
Dr. Lachlan, how are you?
I'm feeling very well, thank you.
Excellent, very good to see you. So it's 72 hours after surgery today.
Yes, it is. It is.
You're upstanding already.
Well, I was standing after 24 hours and walking all over the place after 30 hours. So
Excellent.
And, I'm
Excellent.
not quite ready to play golf yet.
Yes.
Almost.
Almost there. Almost there.
Yes.
So we're starting with the pitch and putt first.
That's right.
Now, did you require much analgesia in the first 24 hours?
No. Panadol.
Right.
And something else I'm not quite sure, but the residual pain that I've had over the first 24 hours and since then has been negligible, to the extent that I don't need anything now at all.
Just wondering whether we've done the surgery. Excellent.
I can show you the scar.
All right. So you've been walking around, and during the first 24 hours, we of course gave you some precautionary calf compressors to try and develop any clots. That was part of prophylaxis to try and prevent any possible complications with the DVTs, with the clots in the legs. So that went well, okay. And as you said, 30 hours you've been walking around, doing the laps around the ward,
Yep.
And now you're ready to go home.
I am, yes. I'll be packing off in an hour or so.
Right, excellent.